Hey guys, welcome to another question of the day. Today's question is, do you require a patient to be at a specific weight prior to having a breast reduction? So I'm gonna pull reduction out of there, and we're gonna talk about weight in surgery and how those go together and why that is a very important question. We've discussed BMI in the past, or body mass index. So I'm gonna talk a little bit about body mass index. I'm gonna talk a little bit about the wellness concept that we're actively doing now and how that can help you and why that's important relative to your surgery. The reason that weight is important relative to surgery and what I do for a living is when we're doing things like tummy tucks and removing skin, or we're doing breast reductions to reshape the breast or a breast lift. As a patient or a client loses weight, the skin becomes deflated and skin becomes more saggy. That would change my operation. If I did the operation while you still were carrying a little too much weight and then you lost a lot of weight, you may need surgery again. So let's talk about body mass index and how we use that to guide our patients. Now, body mass index, it's not an end-all be-all, and I'm gonna explain also what that means. So body mass index is a measurement that we use in medicine. Everyone uses it as just a general guideline to let us know where you are in your health journey of your weight. And what it does is we look at your height and your weight and we get a number. And that number tells us whether you're in the obese category, moderately overweight, normal weight, or even underweight. The reason that it's important to have a normal BMI, which is 30 or less, is kind of the place where I would like for patients to be for surgery, is because that lets us know that you're at a place where you're probably, even if you lose some more weight, not gonna lose enough weight to have an effect on the operation that we're gonna do. Now, the reason that BMI is a little bit not that specific is, let's take two patients. Let's take a patient who's 5'7" and weighs 150, and another patient who weighs 5'7" and is 150 pounds. The one patient who's 5'7", 150 might not have a lot of muscle mass and their BMI might be 30. The other patient might have a lot of muscle and be very lean, but they still weigh 150 with a BMI of 30. Clearly, the conversation about having surgery in those two patients is very different. So when I see a patient and I see their BMI, I don't prejudge before I walk in the room whether you can or can't have surgery. I use that to set myself up in my brain as to whether I think you're a good candidate or not. But then when I walk in the room, if I see that, hey, look, you're a taller patient, you have a lot more muscle mass than you do fat mass, look at your tissues and identify whether I think you're ready for surgery, you might have a BMI of 30 or 31, be prepared for surgery. Or you might be the other person who I look at 30 and say, listen, you want a breast reduction? You still probably have 10 to 15 pounds to lose, and that's going to affect the shape of your breast. And so in that scenario, I would consult with you to tell you, we need to work on getting your lifestyle and your meal planning and your exercising in shape so that you can lose some weight, so that you can have the best, most long-lasting result possible. And that brings me to the wellness concept. And one of the things that I'm doing in my practice that's gonna greatly help my patients is we've already started this wellness concept where if I have a patient like you and I say, hey, listen, you're not quite ready for surgery, you're struggling with your weight loss journey, we're gonna help you dial that in. We have a macronutrient coach that's gonna help you dial that in. So we have a process in place so that we can help you achieve your goal and then have your surgery safely. So I appreciate you asking that question. I hope that brings you some clarity about how weight relates to having a procedure and whether you're ready or not. Again, you guys ask the question and I will answer it. Have a great day.